welcome to the SVG-TV news for Tuesday, January 12th. I'm Khalil Kato with the details. On Monday, St. Vincent and the Grenadines confirmed 4 new cases of COVID-19. All of the cases are nationals with no recent travel history. A news release from the National Emergency Management Organization, NEMO, said 1 adult was detected during contact tracing and the other 3 cases were found during testing for travel exit screening. There are now 124 local cases under investigation. 106 persons have recovered and 147 remain active. A total of 253 cases of COVID-19 have been reported in St. Vincent and the Grenadines. NEMO said all positive cases will continue to be isolated until cleared by 2 negative tests, noting that the established public health interventions of detection, testing and quarantining or isolation are aimed at containing and suppressing this outbreak. NEMO also said that the increased testing associated with these interventions, coupled with the increased exit screening required for travelers to Canada and the United Kingdom, continues to be associated with a significant backlog of samples awaiting PCR processing. It said the overnight addition of 605 new samples has now resulted in more than 900 samples waiting to be done. However, the recent engagement of more staff is expected to allow for the processing of these outstanding tests within the next 3 days. Meanwhile, Prime Minister Dr. Ralph Gonsalves on radio on Sunday acknowledged that the molecular laboratory unit has been overwhelmed with testing for COVID-19. PM Gonsalves said they are exploring other options to quickly process the tests, noting that he has reached out to a private health institution to help with the processing.
Talking to me about a particular, an additional option with a private sector lab. We can assist them in helping to do work too. I'm getting a paper. I was hoping to get it by this morning, which the Ministry of Health was preparing, which I had spoken to the Permanent Secretary in the Ministry of Health about, to see additional things which we can do and what resources are required to do other things in respect of the testing.
And infectious disease specialist Dr. Gerald Thompson said that persons looking to travel out of SVG and need a PCR test should apply days in advance. Dr. Thompson, who is on the COVID-19 task force, said there is a demand for these tests with a backlog of more than 200.
It's a protocol. We want people to apply. If you're going back in 2 weeks' time to England, apply now for the test. Don't come the day before. I want a test because I'm leaving tomorrow. Can you give me a test so I can get the paper and so? Because they can't respond in that period of time. And so we have a website that we want people to apply at least 5 days beforehand, so that we can schedule your test for you. Thursday, I should have my test back, and they're calling and they're abusive of the hotline and so forth. I won't get out. But I say 2 things. One, it's really the Thursday they're supposed to, and you've told them that, but someone will tell them, no, it's a Wednesday. Come out so we could go to a fete or we could go somewhere or something like that. You know, you're here too long. Those are the attitudes that really have been coming out.
The infectious disease specialist said it is possible that the new variant of COVID-19 is an SVG, which could account for the which accounted for by the rapid spread of the virus, and that new equipment to test for the variant is also now available.
The non-linking with the quarantine measures. And it's unfortunate that case some technical issues with that case. But the stringent measures have to be put. Please, we're making an appeal to everybody. Those people who have been on quarantine, stick on the quarantine. And we found that it's relatives here who've been telling man, forget about that, man, come out, you know what I mean, so forth. Let's go to this event or so. But I believe that we had a spike. 55 cases, just recently 19. We are watching this week to see if it comes back down. We know that a number of people have been exposed. There's massive amount of testing being done.
In light of the increase in the COVID-19 cases in the country, Prime Minister Dr. Ralph Gonsalves said consideration has been given to recommence a shift system for public servants. The Prime Minister made this known on radio on Sunday. He noted that various government departments are in the process of making the necessary arrangements.
Well, in the public service, you remember we had at an earlier period a rotation of staff, and various departments are looking at the way in which they can do rotations without affecting the delivery of the goods and services.
Okay.
Remember, we did that for a couple of weeks.
Right. Yes.
Earlier on. We have many of these things, as we said, you ramp up when the circumstances admit or demand, and scale back as the circumstances warrant.
In reference to the national budget presentation, PM Gonsalves said this is still scheduled to take place later this month with a date to be finalized.
With the Minister of Finance and the Director General of Finance and Planning and his team to finalize a few things. But we'll have the estimate sometime in the third week of this month.
Okay.
20-something. I was hoping that we'd have been able to go to the Printry this weekend, but there are a number of things still which we are sorting out.
Okay.
Some numbers and the narrative also in some of the estimates.
The Prime Minister said with new permanent secretaries at various ministries, there was a slight delay in bringing them up to speed with the estimates.
In fact, until last night I was going through the narrative of some ministries. Some of the permanent secretaries were not as careful in tidying up their narratives. I think what happened is this: we have had some changes in permanent secretaries, and one set did the earlier draft and the other set haven't really cleaned them up as well as they should have cleaned them up. This is not a criticism of the permanent secretaries, I'm just making an observation.
Health Promotion Officer Shanika John says the revised mass gathering protocols by the Ministry of Health were designed to slow the movement of people in general spaces. As part of the revised protocols, indoor gatherings have been reduced from 200 persons to 10 and outdoor gatherings from 400 to 20. Speaking on NBC Radio this morning, John said there have been some concerns from churches and promoters about the revised protocols, but she said that they were warranted.
For the last weekend, I heard a number of comments as well. Persons were saying, I have big spaces, churches in particular, I have big spaces, why can't I take more persons? But this specific protocol with the specific numbers was really designed to slow and to stop the movement of people within those general spaces. I know a number of the promoters would say as well that, if I want to have an event in Victoria Park and Annisvale, I could house this amount of persons and I could do this. But it's really just to slow the movement of persons and to avoid people gathering where necessary. So this is also ideal for us to kind of contain exactly what's happening with us in country as well.
John said at this phase of the COVID-19 situation in the country, with several clusters and local cases, it does not matter if the indoor space is bigger or smaller. The steps taken by the Ministry of Health are to help reduce the spread of the virus.
At this time, at this particular phase, before when we started earlier in March thereabout, we give consideration for persons who had big enough space, quote unquote, to accommodate. And so we sent our public health team to go in, to assess the space, to lay out. And this was specific to churches in most instances. In this particular one, we're maintaining the number simply because we want to slow people from moving. Ideally, we do recognize that there's a lot of fear and anxiety that's happening with a number of persons. And people have a tendency of running to God, for answers in these times. And we really do not want to have any super spread or anything that is being transmitted within these settings, and then people are potentially leaving this setting to go back into their primary setting as well.
Despite the few concerns, John said there is a general adherence to the revised mass gatherings protocols.
Particular have gone fully online until further notice. Promoters, as disappointing and disheartening as it is, have decided to postpone a number of their activities and events and so forth. And we really generally seen persons adhering to the mass gathering protocol. And it came sudden because of what was happening at that time. I think that was just the day before, the very morning that we had reported one of our highest recorded number of cases. So again, we want persons to remember the context in which we're operating in.
There are flu clinics set up in each of the 9 health districts across the country, which the health promotion officer is encouraging persons to utilize. John said that persons could go directly to these flu clinics to get care, tested, and checkups for COVID-19.
Yes, that is correct. So this is outside of the normal regular activities that would happen at the clinic. So there is now a flu clinic area. And the team that is there, they will do their triage and their assessment, and they will do the screening and everything that is necessary, and then they would best advise you. So for persons right now, we had a lot of persons who are calling, just generally wanting to get tested. We do have some persons who are showing symptoms, flu-like symptoms. We would ask them to refer to their flu clinic. And when you get to the flu clinic, the team is going to ask you some very basic questions. Your name, your age, why are you here? Do you think you are a contact of a positive case, or you're a contact of a contact? It's just a general testing and so forth. And then they would guide you in a particular direction. So we really want persons to utilize that particular service as well.
Scientists from the UWI Seismic Research Center are now closely looking at the impact the gases emitting from the La Soufrière volcano are likely to have on people in the close environs of the volcano. In a Facebook interview with the UWI SRC, Professor Richard Robertson said that the burns to the vegetation around the crater is more evident, and his team is now looking to see how much impact it will affect, or actually how much it will affect persons, especially those who have health issues.
Yet such that people who have asthma and people who have respiratory problems might find some discomfort. So what we have done is that we have recommended that the authorities start monitoring. We'll advise them on that, monitoring the environment, looking at what the concentrations of gases are in currently occupied areas, even though it's not anything above normal. But if they start now, if and when it increases, they'll detect that and then they could take action.
When asked about the likelihood of a tsunami, as is usually the case whenever there is a volcanic eruption, Professor Robertson said that at this stage of the La Soufrière eruption, which is effusive, it is highly unlikely.
Sometimes when volcanoes erupt and when you have big eruptions, and even when they don't have big eruptions, sometimes large mass parts of the volcano itself could fail, and basically either because of an eruption, an explosive eruption often, or because of the fact that you had a big earthquake and there's a lot of loose material. If a large mass of it falls into the ocean, it could push the water and it could generate a tsunami. That kind of scenario we don't think at the present time at Soufrière is one that is very likely. Of course, all of the volcanoes in the region has had some kind of activity like that. We've had what we call flank collapse. And flank collapse is always something that is possible in the realm of things that any volcano can do. But right now, we don't think where the fact that you have a small dome, it's not beginning to get to the stage where it's pushing too hard against the crater wall. We don't think flank collapse, and therefore the possibility of tsunami being something that is very high.
Meanwhile, the Caribbean Disaster Emergency Management Agency, SEDEMA, coordinating unit, has received funding from the United Kingdom Foreign, Commonwealth and Development Office in the amount of £51,000 to cover the cost of a rotary helicopter aircraft to assist with the monitoring of the La Soufrière volcano. The aircraft will be used to support access to sampling of the extrusive materials, airlifting equipment, surveillance and reconnaissance, and other relevant support for the monitoring of the volcano. The funds were provided through a Memorandum of Understanding on the UK support for the SEDEMA Response Teams program. According to SEDEMA, the request for a rotary aircraft was made by Prime Minister Dr. Ralph Gonsalves through the National Emergency Management Organization, NEMO. The agency said the aircraft will support the ongoing monitoring by the UWI's Seismic Research Center's scientists on the ground. Professor Richard Robertson, who's leading the monitoring team, has indicated that the aircraft is required initially for a minimum of 7 days and subsequently on an as-needed basis by the scientists. This support, Sidima said, is extremely urgent to allow the scientists to analyze the data and present to the government of St. Vincent and the Grenadines an informed interpretation of current volcanic events. Meanwhile, later this week, 2 scientists from the SRC based at the Montserrat Volcano Observatory, Dr. Thomas Christopher and Dr. Adam Stanton, are expected to join the current team on the ground here to help with the monitoring of the volcano. 6 years ago today, the nation was plunged into mourning with the tragic rock gutter accident which claimed the lives of 7 students, 5 of whom were accounted for and the other 2 remained missing at sea. The students from Fancy in the North Windward area were on their way to school on that fateful January 12th when the bus in which they were traveling went over an embankment and ended up in the rough sea. Every year, family members and friends of the deceased come together for a memorial, but this year there was none due to the COVID-19 pandemic. 6 years on, the tragedy remains painful for one of the relatives of the deceased and the survivors. Carlita Thomas, whose son survived the accident, remembers the fateful day as if it were yesterday.
That morning I was in Mountain when I get the phone call and said the red van with the school children turn over. And I said, what it is? And they say, the school van with the children turn over. So I said, my God. And then I run up to my cousin, I tell him, and he was drinking his tea, he dropped it and we run down. But my husband was homesick, he did have cancer. So when I came and I meet him, sit down, he said, Tyson ain't die, and he ain't die. So I said, how you know? He said, I'm sure he ain't die. So everybody calling, they find this, they find that, and I can't hear they find Tyson. I was up and down in the house, with my hand on my head, crying, and people was calling me and cheering me up until about an hour after, I understand they find him. But when they do find him, he had a piece of steel within his leg, and they took him to the clinic in Oya, and from there they carried him to the hospital. And he was there like 3 weeks, he came home.
2 cousins of Thomas did not survive the accident, and though she misses them very much, she says she gives God thanks every day for sparing her son's life.
Thank God that he alive. He 18 years, the 3rd of December, he going to college. And I just have to give God thanks and praise for what he has done for me. And he have him here for a reason. So that is it. I just thank God he's alive today. The rest children that die, we know about them parents. I enter in the feelings too, but we just have to comfort one another. It don't happen and we cannot bring them back, but we always remember what happened.
Support was pledged to those who survived the accident, and though not much, Thomas said she has received some form of support for her son, who is now in college.
I got a letter from the Prime Minister. It was signed by him. I think it was right and signed by him that he's going to support Tyson from secondary school to college and from college to university. And well, in college I get some finance from them to put him in college and whatsoever. And that is all, just for the college thing.
After the accident, a school bus was donated to transport students from Fancy. This service is ongoing. Minister of Education Curtis King has made an appeal for internet service providers to work together with the Ministry of Education to provide better internet service to schools across the country. Minister King was speaking with SVG-TV News via a telephone interview ahead of the start of online classes, which began on Monday for most schools across the country due to the delayed face-to-face teaching.
To say that the government is always looking for an enhancement in the delivery of the services, so we are hoping that the providers will also come on board and work with us to make sure that persons have access.
Minister King also asked that persons who do not have internet access report to the Ministry of Education.
Where students don't have access, though, we are asking that the teachers, the parents, report to the Ministry of Education so that we can see how best we can work out a solution to that challenge.
The Education Minister also urged parents to monitor their children's online activities.
Parents, again, I want to urge you to monitor your children, because we know that some of our children get easily distracted. Please monitor them to ensure that they are ready, that they are in fact participating, and that they are gaining the benefits from what is being offered.
And President of the SVG Teachers Union, Oswald Robinson, says there are teachers and students in the Southern Grenadines still without devices to take part in the online classes.
Seems to me as if the teachers in the Southern Grenadines have been overlooked, because the teachers and students from the Kanawan Government School, they do not have devices. Okay? The teachers in Union Island, the primary schools in Union Island, the Mary Hutchins primary school, the Stephanie Brown primary school, they do not have any tablets, which the government was distributing. So that is something that the authorities need to look into.
Robinson says while he commends the government for already distributing tablets to most teachers, grade 6 students, and those at the secondary and tertiary levels, it is imperative that all students receive their devices.
K to 5, they do not have any tablets, right? And that's the foundation. The foundation is in the primary school, in the early childhood centers. So the authorities need to make sure that they get it right. We have to try to get all the students on the same level. Some can have and some don't.
30,000 devices were pledged by the government of SVG to be distributed to students across the country from kindergarten to the tertiary level. While inadequate access to devices for e-learning is a major problem for students, the Teachers Union president says internet connectivity is also compounding the issues facing students, teachers, and parents using the online system for teaching and learning. Robinson made an appeal for the authorities and the various telecommunications companies to come together to solve the issue.
I have been part of the process of soliciting views from parents, teachers, students, all the stakeholders in education. And all the findings would have been presented to the Ministry of Education. What the problem is to implement in a systematic way to resolve all the issues we are having. We said we need a blended approach. The large schools, which you can't maintain physical distancing, social distancing, you stagger.
Continuing on his advocacy for the students and teachers across SVG, Robinson said there are many other challenges with the e-learning and that dedicated teachers are willing to try a blended approach should an extended closure of schools be mandated.
Cost some more money to provide a better service. I know the government will try to do it. I know the government will try to do whatever is going to make the system better. But the internet provider must take some of the responsibility. It's not only in the school system. You see, it's a big challenge now to get the students connected online. Lack of internet, in some cases poor internet accessibility. I know there are teachers who have been complaining they can't even download the platform. So I am hoping that we'll be able to get it right. It's going to take some time, yes, but I'm asking that we do it and do it properly.
Robinson added that teachers would have gone above and beyond during the pandemic to reach out to their students, especially those with limited access to technology. He said utilizing a blended approach would further safeguard students who are facing challenges when e-learning is the only means by which they can be taught.